St. Vincent's Hospital, chief of medicine at St. Vincent's Hospital. How's it been like dealing with the pandemic the past year for you?
So the pandemic has affected all hospitals, and we have been no exception. However, what has been exceptional is the teamwork at St. Vincent Hospital. Our physicians, our nurses, our allied professionals, our leadership in the hospital from our CEO downwards have all been extremely cooperative, and we've worked together as a team to be able to take care of all the needs of our patients. So we have been able to not only keep our employees safe, get vaccine for all our employees, take care of our patients. So it has been a wonderful experience of working together as a team, and I could not be more proud of St. Vincent Hospital at this time.
In the medical community, you've served in a number of leadership roles. How does it feel to be selected by your peers to become the president of the American College of Physicians?
So it's a humbling honor to be selected as the president of the American College of Physicians. It is truly remarkable that my peers have found me worthy enough to take this position and to represent them as a voice not only at the top levels of leadership in the country, but also internationally. So I'm really humbled and honored by this recognition.
As a result of the pandemic, do you think internal medicine has changed?
Yes, internal medicine has changed a fair amount for a couple of different reasons. One, I think the way people access care has changed. The difficulties or the financial and economic challenges of the pandemic have cost people their insurance, their livelihoods, their ability to access care. However, the one good thing that has also happened is that as a result of the pandemic, we are able to now do televisits. So we are able to come to the patient in their own home via a virtual platform, either a video or a telephone call, and able to provide care. So people who could not leave their house or have to care for family members who are unwell or have young children who are at home in school, and they have continued to get access to care even when they are not able to come to the doctor's office. So there are mixed challenges as well as some blessings of the pandemic.
As the president of the American College of Physicians, how will you advocate quality, accessible, and equitable health care for Black and Hispanic people, and also for people with HIV?
So the American College of Physicians has as one of its vision and mission statements to promote both diversity, equity, and access, along with justice for healthcare professionals as well as for our patients. This is one of the primary goals of the college, and the college strongly advocates through position statements. I sign press statements, I sign friend of the court briefs, which are sent into Congress to advocate for equity, not even only in the pandemic, but even in a pre- and post-pandemic world, of equity of care, affordability of care, access to care, and access to vaccines specifically related to COVID-19. And in my own world of infectious disease, of which I'm a specialist, HIV is very dear and near to me, and I personally care for a population who have HIV, and I feel strongly that their access to care should be equitable and the same as for everyone else. So I will strongly advocate for that in my year as president.
What attracted you to become president of the American College?
So I was asked to get involved in leadership, initially as the governor of the American College of Physicians for the state of Massachusetts, which I did. And then I became the chair of the Board of Governors. We have 89 governors representing states in the United States, the uniformed services, and then countries in the world where we have a presence. So I became their president first, and then I became a member of the Board of Regents, which is the trustees of the college, and then was asked to run for a leadership position. So till I was selected, I had no idea that I would be becoming a president of the American College of Physicians, but having now started in that position, I'm deeply humbled and honored at the trust that's been placed in me.
What would be some of your primary duties?
So my primary goal is to be spokesperson for the House of Internal Medicine and its subspecialties. The college has 163,000 members across the United States and in 145 countries across the world. I am responsible for being the spokesperson to represent all of them in the House of Medicine as well as in the House of our elected leadership, which is Congress. So I represent their voice in Congress. So I write letters to our elected leadership. I write press statements. I speak to the press about challenges in medicine, new developments in medicine, new scientific developments. I represented the United States to other major medical societies around the world, such as the European Federation of Internal Medicine, the World Congress of Medicine, the Asian Pacific Congress of Medicine, etc. So I'm the representative of the voice this year for the Internal Medicine and the House of Internal Medicine as the president of the college.
Mental Health Awareness Month, a big issue in the medical community is burnout. How will you, as the president of the American College of Physicians, address that issue and advocate for that?
So the challenge of mental health, both not only for patients, but also for healthcare professionals, physicians, nurses, allied professionals, and the concept of burnout is huge. It's a daily challenge. In the physician community, the estimate is 1 death per day of physicians from burnout, either self-inflicted or through other reasons. And so it's a huge challenge. The stresses of practice of medicine in general, more so in the pandemic, has increased that awareness. We have a robust program around what we call zero burnout, so which is to move away from burnout as a negative term and instead to promote wellness. So we are actively promoting wellness, which is the positive image, and to take away from the negative image, which is burnout, and to say, how can we improve wellness among all of us as providers? The Institute for Healthcare Improvement talks about the triple aim of improving healthcare. We talk about the quadruple aim. The fourth leg of that aim is wellness of the healthcare professional who cares for others. So the caregiver needs to be well to provide good care for others. And so that is one of our focus, which continues to be at the forefront of our interest.
One final question. I know you and Dr. Hirsch during the pandemic have become closer. He always has a famous quote when he does his press conferences and stuff. I was wondering if there's a famous quote that you live by every day that inspires you.
Well, my personal favorite quote is, if you are not at the table, you're on the menu. So it's important for us as physicians and healthcare professionals to be actively involved in advocating for our patients, advocating for our institutions, advocating for the system, for a better system where we all can thrive.